This is Joan Dragon. Today's date is June 8th. I'm going to be doing a head to toe. Alright. Knock, knock, knock. Good afternoon. I'm going to be your student nurse for today. My name is Joan. Can I have your name and date of birth?
My name is Booz Darajin, and my birthday is July 6, 1986.
Okay, give me one second. I'm going to go wash my hands and I'll be right back, okay?
Alright.
I'm performing hand hygiene right now. Okay, hands are clean. All right, I'm gonna provide my patient privacy. All right, so you gave me your name and date of birth. Are you experiencing any pain today?
Just a little bit.
Okay, where is it located?
My lower back.
Lower back? Okay, describe it a little more for me.
It's just, when I sit down for too long, it irritates me. And then, when I walk a little too long, it irritates me. So, I gotta stand up, sit down, as long as I keep.
So that's what makes it worse?
Yes.
It makes it worse?
Yes,
okay.
when I sit for too long.
Okay, all right. So on a scale of 0 to 10, like, how would you rate it?
4.
Okay, all right. So we can have your provider look at that after we're done with the physical assessment, okay?
Okay.
All right. All right, could you please tell me the current place that you are in?
Rhode Island.
Okay. What is the president's name?
Donald Trump.
Okay. The season that we're in?
It's spring.
Spring, okay, thank you. All right. Are you having any numbness or tingling in the body?
No.
Okay, great. All right, so what I'm going to do is look at your head, okay? All right, so I'm inspecting the scalp. There's no lesions, there's no redness, there's no infestation. The hair is evenly distributed. Can you look at me? Can you look for it? All right. I'm going to look at your eyes, assess his eyes. Do you have any vision problems?
No.
Wearing glasses?
No.
Okay. So the sclera is clear. There's no redness. Can you pull down your conjunctiva? All right, so there's no redness or drainage in the eye area. You can let go. All right, I'm gonna look into your eyes. Okay. All right, so his pupil size is about 3 millimeters. I'm going to assess his perla right now. All right, can you just follow this for me? Okay, so pupils are round. They're equal. The pupils are equal, round, and they react to light, and they also accommodate. I'm gonna check out your ears. All right, so there's no lesions, abrasions. Does that hurt at all?
No.
Okay, so there's no tenderness. Check this ear. Same thing, I'm gonna look into it. No drainage in the ear. Up and back, and I do see the gray pearl tympanic membrane. All right. No drainage in this ear as well. You see the gray pearly tympanic membrane. All right. All right, now I'm gonna check his nose. His nose is midline. The septum is, there's no deviation in the septum. Can you look up for me so I can just check? No drainage. All right, can you close one nostril and blow out the other? Can you do it today? So his nostrils are patent. I'm gonna check out his mouth. The lips are not dry, they're pink. Can you open your mouth for me? All right, pink and moist. There are no lesions, no bleeding. Can you show me your teeth? All right, so his teeth are evenly distributed. All right, so I'm gonna ask you to smile for me. Can you make a frown? All right, can you puff out your cheeks? Can you raise your eyebrows? All right, so his cranial 12 nerves are all intact. All right, I'm gonna palpate his trachea, and that is midline. Palpate his lymph nodes. Does that hurt at all?
Mm.
Okay. So no abnormalities with that. All right, so now I'm gonna assess his muscular system. Well, assess his strength. All right, so I'm gonna press down on your shoulders. I just want you to like add the resistance, okay?
Mm-hmm.
All right, can you do that? All right, so he's nice and strong. Can you pull my fingers?
Pull them.
Well, squeeze. All right, thank you. Now press against my hand. All right, I'm gonna do it to you. All right, so he's nice and strong. Now I need you to rotate your wrist for me. So I'm assessing range of motion. Your elbows. And then your shoulders. Okay, thank you. All right, do you ever experience any coughing or short of breath?
No.
Okay, great. All right, so I'm gonna listen into your lungs. So every time I move the stethoscope, I just want you to breathe in and out for me, okay?
Okay.
Okay, so I'm gonna do the posterior. Okay, breathe in and out for me. Okay, so lungs were all clear. There were no crackles, no wheezes, no stridor. All right, so now I'm gonna ask you to, okay, I'm gonna check your heart valves, your heart sounds, but let me first check your fingers. So right now I'm assessing capillary refills. Everything is less than 3 seconds. Okay, and there's no clubbing on the fingers. All right, do you experience any dizziness at all?
No.
Okay, great. All right, I'm gonna assess his pulses bilaterally. Can you bring them in like this? You can get closer.
No.
All right, so they're about a 2+, which is normal. All right. Let me listen to your heart sounds now. All right, so right now I'm listening to the aortic valve. And this is to the second intercostal space to the right of the sternum boredom. Now the pulmonic is the second intercostal space to the left of the sternum boredom. The Erb's point, this is the third intercostal space to the left of the sternum boredom. The tricuspid valve, which is fourth intercostal space to the left of the sternum boredom. The apical, and that is on the left to the sternum boredom, on the fifth intercostal space, mid-clavicular line. All right. There were no murmurs, no palpitations, nothing abnormal. All right, can you lay down for me? Lay back. All right, so now I'm going to be assessing his stomach. And it's flat. There's no distension. It's not rounded. I'm going to listen into. So I'll start counterclockwise. Okay. It's very active. I hear the sounds. So that's a normal finding. So there are clicks and gurgles in the abdomen. So let me ask you a few questions. Do you have any problems using the bathroom at all? Like constipation?
No.
What about with diarrhea?
No.
Do you experience nausea or vomiting at all?
No.
Okay, great. And you're able to use the bathroom on your own. You never have an issue with that?
Yes.
Okay, what about with urination? Does it burn at all when you have to use the bathroom?
No.
Okay, so when was the last time you actually moved your bowel?
Last night.
Last night, okay. And the color of it?
Brown.
Brown, okay. All right, and the last time you actually voided?
Voided.
Like, you went to, yes.
Maybe an hour ago.
Okay, and the color of it?
Yellow.
Okay, did it have any type of smell or anything?
No.
It was clear? Okay. All right, so I assessed his urinary. He's okay with that. Now I'm going to check out his pedal pulses. I'm going to ask you to take off your shoes, please, on both.
And socks.
Oh, wait, can you lay back? I did forget to check your JVD. All right, so I need you to turn that way. So right now I'm assessing JVD, and there's no JVD. If you want to come over on this side so you can make sure it's... So there's no JVD on this. All right, I'm going to look over to the other side. And no JVD. Okay. All right, so can you please take off your shoes for me?
And socks?
Yes, please. All right, so right now I'm going to assess his capillary refills on the toes and also check for his pedal pulses. All right. So, see? Yeah, of course. All right, so checking capillary refills. Okay. Everything is less than 3 seconds. All right, I'm going to check his pedal pulse. Okay, pedal pulses are +2. I'm going to check for edema. All right, no edema. And throughout the whole process, I was assessing the skin. There was no lesions. There was no redness. Skin is normal to his ethnic race. And that is all. Thank you for being my patient.
Thank you.